rotator cuff tears and the role of Regeneten in treatment. Today, I'd like to focus on rotator cuff tears, a common shoulder injury, and highlight how the innovative Regeneten bioinductive implant is transforming the way we treat these injuries. We'll discuss what the rotator cuff is, the causes and symptoms of tears, and why Regeneten is a game changer in both surgery and recovery. The rotator cuff and its function. The rotator cuff is a group of 4 muscles and tendons, the supraspinatus, infraspinatus, teres minor, and subscapularis, that originate from the shoulder blade and attach to the top of the humerus. The rotator cuff's primary job is to provide dynamic stability, keeping the shoulder joints ball-centered in its socket through a wide range of motion. It also assists with arm elevation and rotation, making it essential for everyday tasks. However, due to its constant use, the rotator cuff is susceptible to wear and tear, leading to injuries over time. Rotator cuff tears causes and symptoms. Rotator cuff tears are very common, particularly in older adults, and they often develop gradually. They are usually not caused by a specific traumatic event, but are the result of repeated stress or aging-related degeneration. Patients with rotator cuff tears typically experience 1. Pain when lifting the arm, especially overhead. 2. Night pain, particularly when lying on the affected side. 3. Weakness or difficulty performing tasks that involve arm elevation or rotation. Regeneten, a revolutionary approach. When it comes to surgical treatment, traditional techniques have been effective, but recovery can be slow and painful. This is where Regeneten, a bioinductive collagen implant, makes a significant difference. Regeneten works by stimulating the body's natural healing processes to repair and strengthen the rotator cuff. Here's what makes Regeneten unique. 1. Bioinduction. The implant encourages the growth of new, healthy tendon-like tissue over the tear. This strengthens the rotator cuff and supports the healing process. 2. Minimally invasive. Regeneten is typically placed arthroscopically, meaning less surgical trauma and faster recovery. 3. Pain reduction. Many patients report significantly less pain and faster pain relief compared to traditional repairs. How Regeneten fits into rotator cuff repair. Regeneten is particularly useful for partial thickness tears or as an adjunct to full thickness repairs. During surgery, 1. The collagen implant is placed over the tear to support tendon healing. 2. For partial tears, this may be the only intervention needed. 3. In cases of full thickness tears, Regeneten can be used alongside suture anchors, which reattach the torn tendon to the bone. This flexibility allows surgeons to tailor the treatment to each patient's specific needs. Rehabilitation timeline with Regeneten. One of the key benefits of Regeneten is the shortened and more comfortable rehabilitation period. 1. Sling use. Patients typically wear a sling for only 1 week. 2. Early movement. Therapy starts as early as 1 week post-op, focusing on gentle movements to prevent stiffness. 3. Strengthening. Strengthening exercises can begin at 6 weeks post-op, significantly earlier than with traditional repairs, which often delay strengthening until 8 to 10 weeks. This accelerated timeline helps patients return to their daily activities and work faster. Why patients prefer Regeneten. One of the biggest concerns for patients considering rotator cuff surgery is postoperative pain and the long recovery. With Regeneten, we've seen significant improvements in these areas. Pain management. While the first 2 weeks can still be uncomfortable, pain tends to subside much faster with Regeneten. Reduced medication use. Patients often need fewer pain medications, including narcotics, due to faster healing. Improved quality of life. By accelerating recovery, patients regain mobility and strength sooner, allowing them to resume their normal activities. Case studies and outcomes. In my practice, I've seen remarkable results with Regeneten. Patients who previously worried about prolonged downtime are often surprised by how quickly they improve. By the 4 to 6 week mark, most report a substantial decrease in pain and increased range of motion. Compared to traditional repairs, Regeneten has consistently provided faster recovery and better patient satisfaction. In summary, the rotator cuff is essential for shoulder stability and movement, and tears can significantly impact quality of life. While conservative treatments like therapy and injections are effective for many, Surgery becomes necessary when pain and dysfunction persist. Thanks to Regeniten, we now have a powerful tool to improve surgical outcomes. Its ability to promote natural healing, reduce pain, and shorten rehabilitation timelines has made it a preferred option for many patients and surgeons alike.